High blood pressure, hypertension, is called the silent killer for a reason it rarely announces itself. You can feel perfectly fine for years while it quietly damages your heart, arteries, and organs. But your body sometimes sends subtle warnings, clues that shouldn't be ignored. Today we'll break down 10 early signs of high blood pressure you might be missing. My goal? Help you recognize these signs before a crisis hits. Let's dive in. First, frequent headaches, especially new or severe ones, can be a warning. High blood pressure can cause pulsating headaches, often worse in the morning, and resistant to usual painkillers. If you notice a pattern of headaches that feel different or more intense, don't ignore it. It's your body's way of signaling something's off. Get your blood pressure checked. Second, sudden dizziness or lightheadedness, especially if it comes out of nowhere, can be a red flag. High blood pressure can disrupt blood flow to your brain, causing these sensations. If dizzy spells are new or frequent, especially with other symptoms, take them seriously. Don't just blame dehydration or fatigue. Talk to your doctor. Third, blurred vision is another subtle sign. High blood pressure can damage the tiny vessels in your eyes, leading to vision changes or even swelling of the optic nerve. If you notice sudden or persistent changes in your sight, don't just assume you need new glasses. It could be a sign of hypertensive damage. Get it checked out. Fourth, chest pain or tightness should never be ignored. High blood pressure forces your heart to work harder, sometimes causing pain or pressure in your chest. This can signal your heart is under dangerous strain. Any chest pain is a medical emergency. Seek help immediately. Don't wait for it to pass. Fifth, shortness of breath, even with mild activity, can be a warning sign. High blood pressure can cause fluid buildup in your lungs or strain your heart. If you're suddenly winded doing everyday tasks, it's time to pay attention. This could mean your heart or lungs are struggling. Don't ignore it. Sixth, an irregular heartbeat, fluttering, pounding, or skipping, can be linked to high blood pressure. Persistent palpitations may signal arrhythmias like atrial fibrillation, which increases stroke risk. If your heart feels off, don't just blame stress or caffeine. It could be your heart struggling under pressure. Get evaluated promptly. Seventh, unusual fatigue or confusion can be early signs. When your heart and brain aren't getting enough blood, you may feel drained or mentally foggy. If you're unusually tired or having trouble concentrating, and it's not improving, consider your blood pressure. These symptoms are easy to dismiss but can be serious. Listen to your body. Eighth, nosebleeds aren't usually caused by high blood pressure, but if you're prone to them, spikes in pressure can make them worse. Recurrent, hard-to-stop nosebleeds, especially if new, can be a warning. It's not the most common sign, but in context, it matters. If nosebleeds are frequent and severe, check your blood pressure. Don't ignore the pattern. Ninth, blood in your urine is always a reason to see a doctor. High blood pressure can damage your kidneys, causing them to leak blood into your urine. Even if it's only visible under a microscope, it's a sign of possible kidney damage. Don't wait. Get it checked. Your kidneys are vital to blood pressure control. 10th, a flushed face isn't a reliable sign of chronic high blood pressure, but frequent, unexplained flushing, especially with other symptoms, can be a clue. It's often triggered by stress, heat, or alcohol, but if it's happening more often, pay attention. Track when it happens and what else you feel. It's another piece of the puzzle. Discuss it with your doctor if you're concerned. These 10 signs are your body's way of whispering that something's wrong. Remember, you can't diagnose high blood pressure by symptoms alone. The only way to know for sure is to measure it regularly. If you notice any of these signs, don't panic, but do take action. Early detection can prevent serious complications. Make your health a priority. Check your blood pressure, talk to your doctor, and stay informed. Thanks for watching. Take care of your heart and your future. Like, subscribe, and share this video to help others stay healthy. Stay proactive and listen to your body.